Hello, folks, and welcome to Give Life. I am your host, meek, mild-mannered Paul Abramson. Coming to you from my multi-trillion-dollar recording studio. Can you do something? Can you believe some of the gimmicks people come up with for these videos? Come and get it. Come and get it. Okay, I like old movies. So today's topic, I have notes. As I mentioned in episode 16, which is so 2 years ago I made the first 15 episodes and then I stopped. It was a very intensive editing style, and well, I said things I wanted to say and then I stopped at 15. So now I'm starting again, so I made 16, which is kind of a reintroduction for 2025. Now I want to get into specific topics. So this is episode 17 of Give Life. And this episode is Let's Change. Oh, I made notes because I have a hard time staying on topic. My mind jumps all around, and I know that about myself. So I made notes to try and keep me on topic. So let's change how we make doctors. Cave people, okay? Cave people. C-A-V-E. This is something that's used in politics sometimes. I've been involved in local politics, different places where I've lived. Run for office twice, lost both times. The citizens came to their senses and voted for somebody else. Okay, let's see. Cave people, C-A-V-E. Citizens against virtually everything. Okay, cave people, that's what C-A-V-E. Oh, I have a fan running because it's a warm day. I hope it's not too distracting. Everything is moving around me, but it's also a little bit cooler, which I do appreciate, and I hope it doesn't make too much noise. Okay, citizens against virtually everything. I think for two reasons. People just being proud and people wanting to have, oh, I want my opinion heard, and they don't have an opinion. They just want to regurgitate what someone else told them. And so you have cave people out there and they want to protest, they want to be upset. You're trying to improve things, you're trying to add a park or whatever it is you're trying to do, they're just against it. So I know that this topic, changing how we make doctors, lots of people are going to be against it at the outside. No, we don't want to do that. We don't even want to consider that. Okay, so that's a given. Midwives. All down through human history, in every culture in the world, this isn't something that people study very often, but it's true. Midwives. Every culture has had midwives where a woman, usually an older woman, helps the mother give childbirth, okay? And often it is then the older woman who then teaches a younger woman or two, one or two younger women, how to be a midwife. Here's what's going to happen. The water breaks. She's going to scream. She's going to scream terrible things about her husband. You'll never let you get me pregnant again. All kinds of stuff like that. Excuse me. I need to stay on topic here. Okay. And but the midwife system works. It's worked all down through time and all around the world. It really has. Okay. Now, in the 1840s in Vienna, this is about the time of Mozart. Okay. Wolfgang Amadeus Mozart. Vienna, cultured modern city, 1840s. There was a doctor, Dr. Ignaz Semmelweis, and he worked at a maternity ward, and these women had a high mortality rate. They were dying, and so doctors would come in the morning, they'd do autopsies on the women who had died overnight, and then they'd check on the live patients and do the procedures, and how are you feeling today, how are you doing, and checking the patients. Well, Dr. Semmelweis discovered that if he washed his hands after handling the corpses, the women who had died, if after they had examined the corpses, he washed his hands, then they examined the live patients, the mortality rates plummeted. They went way down. Okay, I know that sounds weird to us today. This is less than 200 years ago. Even though I want to stick to my notes, but in the Old Testament, in the Bible, it taught that. Clean and unclean, clean and unclean. The Mosaic Law. If you've touched something dead, you are unclean. You need to wash your hands in running water. You need to expose your hands to sunlight, stuff like that. The Mosaic Law was true. Okay, what people had fallen down to in the Middle Ages and then coming into the modern world is forgetting so many things that work, that make sense. The midwife system works. It makes sense. Anyway, in this hospital, he then discovered and had his fellow doctors wash their hands. And not only, he discovered if you wash your hands not only after the corpses, but between each patient. You wash your hands between. The mortality rate went way down. Well, these doctors got tired of this. Now, cave people does not just mean, oh, well, I need to finish my story of Dr. Semmelweis. They ran him out of town. All this stupid hand washing, what do you think we are? You know, dishwashers, we're doctors. And they ran him out of town, out of Vienna. He reestablished in Budapest, repeated his observations that hand washing, for some reason, made it so that patients lived longer. Okay? They didn't die as much. Well, again, in Budapest, they ran him out of town. He died in an insane asylum. Isn't that tragic? It's just tragic. Sometimes people who have common sense, the majority of people, and those who are the experts, are against them. And this is, I think it's more true with people who are highly educated. I am the expert. I know everything. Who are you to tell me I need to wash my hands between patients? Okay, again, I know this is accepted now. Well, less than 200 years ago, it wasn't. And the poor man who discovered this is before Louis Pasteur, okay? Before they had microscopes where they could see germs and stuff. They didn't know germs existed. But hand washing made a difference. Okay, doctors are proud and they can be obstinate. As I said, highly educated people can sometimes be the worst cave people. They're against everything. Jumping to a different area of expertise, of study, Albert Einstein, when he proposed relativity, he had all these physicists all around the world completely against him, because doesn't this young upstart who doesn't know anything, doesn't he realize quantum mechanics is true? What's the matter with this guy? Okay, so this is true. This is part of human nature to resist change. Okay, so I obviously haven't told you anything about what I would propose that we do, and this is just an idea. I'm throwing it out there. Do what you want with it. Throw me under the bus, but keep one or two things from this idea that I'm going to give you. Okay, okay. So now, I went to college later. I think it was 26 about when I went to college. Most people who go to college are 18 or 19. They don't know anything yet. They haven't been out in the world. I had been in the military. I had worked in the job market, worked for 2 different corporations, and I decided if I'm ever going to go to college, I've just got to go. I just have to go. And so I took classes in everything when I went. Everything, I really did. And then I would argue with my professors because they were nutty left-wing lunatics, just like the professors in college are today. Okay, does that offend you? Okay, well then stop being a nutty left-wing professor then. Okay, excuse me. Okay, I need to stop. Okay, let's see. I do not expect medical doctors to be for these, but what I wanted to say about that in college is I think it's good for someone to have a break between high school and college, whether it's working, traveling, or military, Peace Corps. Could be a variety of things. Volunteering in some way, doing some kind of a mission trip for your religion, your church, your type of belief system or synagogue or something. Okay, now there's also institutional bias. There's cultural momentum that favors not changing. Okay, now what is our goal in medical things? What is our goal? Quality, affordable, accessible health care. Right? That's our goal. Right? Right now, that's not happening. Inner cities are very underserved by medical professionals, and so are rural areas. So I'm talking about the United States, although this probably translates to most countries in the world, that rural areas, when you're an hour outside the city, you have very few medical options, or you've got to drive or as fast as you can try to get to that hospital an hour or so away, maybe 60 or 90 minutes away. So our current medical paradigm only helps certain people. Okay, And there's also other serious problems with the current ways that we make doctors, and I'm going to discuss that in a minute here. So let me start to propose how we can change this paradigm. In the military, we make medics, okay, whether Navy, Army. This is true in America, it's true in Canada, Germany, Japan, other countries. A military medic can be made in 6 to 8 months. And that's a person who someone's just got injured on the battlefield. They got shot, hit a mine, fell or something, or in some ways injured. The medic then can get them, clear the airway, stop the bleeding, get the person under control, and medevac them out. They used to have MASH units. There was a TV show. Da, 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 da. It was during the Vietnam War. So this is 50 years ago, 40 years ago. You've probably seen it in reruns. But the setting was the Korean War from back in the 50s. Back in the 50s, excuse me. So they used to have MASH units. Now they call them, instead of MASH, Mobile Army Surgical Hospital, now they call them CSH, Combat Surgical Hospitals. Okay, different name, but it's a similar function. So the medic's responsibility is to get that person, keep them alive for the next 15, 30, 45 minutes until you can get them to the full doctors. Okay, now that makes sense, right? Now I want to transition to civilian life. You've fallen off a ladder at home, or you had a heart attack or a stroke or something, okay, or whatever it is. You call 911, and who do they send out? A doctor with 20 years experience? No, they send out 2 young people in their 20s, right? They're not sending out a full doctor, are they? Right? Now there's exceptions to that. The helicopters, if they do a helicopter, that is often, I don't know if it's true in every state, but I know a man in Texas he's a doctor who's on those things. So for them, they have a doctor on board. But for regular ambulance and stuff, in most states it's 6 to 12 months or maybe less of training to become an ambulance driver, okay? So a year ago or so, I was at a community health fair. Okay, it was just a standard community health care that was put on. It was free. You could go get your blood pressure checked, get your heart rate, check your sight, check your hearing, basic stuff. And near the end, you kind of did this loop. Near the end was a table with 3 young men sitting there. That's what I wanted. They were smart, well-dressed, 3 young men. They look smart, just their countenance, the way they're, I'm sorry, okay, never mind. Okay, so there was the 3 young men. That's where I wanted to go. So I went over there, and they weren't busy. I didn't want to interrupt them if they were busy. And I talked to them for a few minutes. They were all doctors who had not done their residency yet, or they were in that preparation. So they had gone through medical school. My question was money. How much in debt are they because of medical school? And all 3 of them were $500,000 to $750,000 in debt. Why do the medical associations do this? Why? Is the goal people? Is the goal healthcare? Is it to help people? Is it to train qualified doctors? Or is it to make money? Is it all about money? Don't answer. Okay, I calculated this. If you had, so $500,000 to $750,000, that's $750,000. I calculated $600,000 of debt. Now this is not count a house. This does not count a car. This does not count buying a sandwich for lunch today. $600,000 of debt on top of you. It equaled, at 4% interest, equals about $2,000 a month. You can calculate it. $600,000, you can calculate this yourself. At 4% interest, this is without paying down the principals, is $2,000 a month. At 23 work days a month, that's about $87 a day. So $87 a day before you've seen, so that's your price, not even for being alive, just to service this debt. Do you understand the pressure, the load on top of this young person? And it doesn't need to be there. Okay, well, I need to get further into my idea. Okay, into the thing. And that's $2,000 per month after taxes. How much money do you need to make in order to have $2,000 after taxes? Well, probably about $2,600, $2,800, maybe $3,000, because then you're paying in after-tax dollars for the $2,000, and you're not paying down the principal with that, right? Do you see that this problem? How bad it is? Okay, So at $87 a day, that means over $10 an hour in your billing as a doctor. Over $10 an hour, probably about 11 or 12, or probably about 14 actually, because of taxes. So everyone, if you see 3 people per hour and it's $14 extra, you have to add almost $5 per bill just for that, just for the interest on your medical schooling debt. Okay? For so many reasons, the way we make doctors now is absolutely horrible. Okay? That's my opinion. Okay, are you with me? Every step of the way, our current way of making doctors and providing quality health care is almost not working. Now, the liberals, I'm a conservative, a thinking person. The liberals, back in the 1990s, I'm 67, I've told you that before, Bill and Hillary Clinton, the co-presidents, were in the White House in the 90s. And Hillary Clinton had this wonderful idea for health care that she proposed, and they had this huge study and how they were going to make healthcare unaffordable, better for everyone. And they didn't have a single doctor on her team. It became a big embarrassment for them because Hillary Clinton, the co-presidents, isn't America lucky that we have Bill and Hillary? They're both so highly qualified. Excuse me, that was in the 90s, 30 years ago. And not a single doctor. Liberals have fallen so far. Rather than one nation under God, they want one nation under government. And okay, you can tell I'm on the other side of some of this stuff here. Okay, then you move forward in time. Healthcare is still limping along. Many people are not getting good healthcare. So you come up to Obama, President Obama, Obamacare, the Affordable Health Care Act, and what is their solution? Add more bureaucracy, take over health insurance from companies, and make it worse. Study the health care in the UK and Canada. Okay, just study it, or Japan. There are areas where it can be good, but I'll tell you, there's a lot of areas where it's terrible. I'll give you an example from Japan. I lived in Japan for 5 years. Dentists get reimbursed depending on how many patients they see. Okay, this is partially true. So what happens? Instead of one visit, and it's 45 minutes or 50 minutes, they numb you down, they do everything all at one time, bam, okay, you don't eat for the next hour, you're going to bite your tongue, have a nice day, arrivederci, but actually it would be sayonara. Did I tell you I used to live in Japan? I told you that, right? Okay, so anyway. Okay, sayonara. Okay, rather than get it all done in one visit, it is more economical for the dentist to have 4 or 5 visits. Oh, we're going to clean your teeth next time. Next week you'll come in and we'll do this. The week after that we'll do this, we'll do this. And so it's for the society the least efficient way to provide, one of the least efficient ways you could provide dental care. It's just horrible. Anyway, government stuff in the UK, in Canada, sometimes people in Canada, they'll come down to the US if they want the best medical care. It costs a lot more, but it's better than what they got in Canada. Okay, do you see what I'm saying? Socialized medicine, liberal nonsense stuff is not the answer. That's my perspective. Okay. Instead, what we need to do, rather than adding lots of money and crippling our health care even more, let's change how we make doctors. Okay, so now, this is a different profession, but in my mind it relates. Okay, where do we get pilots from? Commercial aviation pilots, say for United or Delta or American Airlines or Lufthansa or Singapore Airlines, anywhere in the world. They often come from the military. They've had 4, 6, or 8 years of flying experience, and now they transition. Those skills completely translate over into a civilian job, right? Okay. Same is true with diesel mechanics. If you were a diesel mechanic in the Army or in the Air Force or something like that, and then you come out and there's a shop that does big diesel trucks and stuff, we're paying you $30 an hour to start, and after 3 months it's going up to $40 if you work out. Can you start tomorrow? I'm serious. These skill sets can translate over. You know that for pilots. It's true for diesel trucks. True for a lot of areas. Why don't we do this for military medics as well? Why not? So let's change the system. 6 to 8 months of training gives you say a junior medic. Let's have 3 levels. Okay, I'm going to put this beside me. Okay, you can see it here. Okay, you have junior medic, say 6 to 8 months. Then you can train while you're working, so you're not going into debt. You're learning while you're doing it. Okay, let's jump back to midwives. How do midwives learn? All down through time, everywhere in the world. They learn by experience, right? But the older woman is teaching the younger woman, right? And it works. That works. Modern medical care, like with Dr. Semmelweis, they were killing women right and left. I'm sorry, I know people are getting mad the way I'm putting this, but sometimes we replace something that works with something that doesn't work, or that doesn't work as well. It may be more professional, but it doesn't work as well. Okay, so you got junior medic, 6 to 8 months. Then you have a staff medic, that's 12, and you have testing. You have standardized testing for each of these. Staff medic, which is halfway up, right? Which is, say, a 12-month. And then a senior medic, which takes about 18 months of schooling. It could take 2 or 3 years, okay? If you're doing it full-time or if you're doing it part-time. You do why not part-time? So working while you're learning, and then you're taking classes a couple nights a week. Why not, right? Okay, and then you have appropriate tests for each level. Why not be able to change careers mid-career into medicine? Why not? Right now you can't do that. They got the medical schools all closed up. They only allow a certain number of schools in. You got all this memorizing. You got all this, cut and drug medicine and stuff. They know all kinds of things about medicines, about what is this bone called and stuff like that. But there's so many areas they're not learning anything about. Okay, let's do a scenario. Okay, I hope this is interesting. Okay, a farming wife, Helen. Okay, that's her name, Helen. She passed the courses. There was a junior medic. Maybe she was in the military, maybe not. But then she passed the courses. Now she's a staff medic. So she's halfway up the line. Am I pointing it about the right place? Okay. Testing to be a staff medic took 1.5 years because she did it part-time. She's not a senior medic, but she's still able to, in an emergency situation, give morphine or other severe pain relievers. Okay? Because she's part of the medical system, a licensed part of the medical system. She's a staff medic. Okay, even though she's not in a hospital, she's out in the country. They live. She and her husband Jim. This is my scenario. Live over an hour away from the nearest city hospital. The phone rings. Jim, tell Helen we need her immediately. Timmy fell off the tractor. He fell off. He's bleeding badly. His leg is broken. He's screaming in pain. Helen gets an insulated pouch from the locked medical fridge, locked refrigerator, because you could have narcotics, you could have insulin, you could have other things that need to be refrigerated, but also need to be controlled substances. Okay? Serial numbers and stuff like that. Okay. She gets an insulated pouch from the locked medical fridge, stuffs it in her medical bag, hops into her SUV or van. 10 minutes later, she's arrived. She's at Timmy. She stops the bleeding and begins to immobilize Timmy's leg. It's a serious compound fracture. Okay. Her EKG and her phone are now connected directly to the hospital. Okay, so she's called in, got an emergency situation, and so things are being transmitted. It's not just a phone call; it's with data transfer. Okay, they have this capability, so they're doing a data transfer with it. So Timmy's vitals are being transmitted in real time. He's going into shock. Dr. Smith at the hospital agrees with her. He says, yes, Helen, give Timmy a shot of such and such, this many cc's, to reduce the pain. Could be morphine, could be something else, okay? The state patrol has just dispatched a car. This is the hospital talking to Helen. The state patrol has dispatched a car to escort you to the emergency room. See you in about 45 minutes. Okay, why not? Why can't we do this? Why not? What if you got the junior medic, staff medic, senior medic? What if the step above that is MD, medical doctor, MD? Why not? After senior medic. Then you have your specialties, okay? Pediatrics, internal medicine, OBGYN, ear, nose, throat, etc. Okay? Now, I'm getting through my notes here and I'm staying pretty well to them, aren't I? Pretty good, huh? I'm sorry. Okay, I see. Okay, Okay, doctors used to make house calls. Let's go back to that. In fact, actually, let's go forward to that. Let's go back up to that. Rather than the suffocating debt that these doctors under, both young men and young women, I mean, how can they handle? That's okay. I already talked about that. It's just okay. Next scenario. Next scenario. I want to see a young black man or a young black woman go into the Navy for 3 years. He or she trains as a medic. So in 3 years, serves their country. They gets junior medic training. Maybe they can even get staff medic. What if they sign up for a 4-year enlistment? The military, the Navy, or the Army, or whichever service they're in, gives them, okay, we'll actually, after 1 year, we'll send you back to school for 3 months, and when you get out of the military, you will be a trained, licensed staff medic. Something like that, right? Why not? Okay, so coming out of the service, this young black man or young black woman, he can, remember I'm talking about 2 areas that are badly underserved, inner cities and rural areas. It's only the suburbs, those rich folks, those people who are still at the middle class, who can afford the stuff, people who are your employer. You don't have an employer paying for your medical insurance, man, you got a problem. You've got a problem. Okay, you know that. You know that if you live in America. Okay, so this young black man coming out of service, he can immediately step into a paying medical job, just like a commercial pilot, diesel mechanic, or other things that can be trained for that cross over from military to civilian. Why not? Okay, so 2 or 3 years, and then after 2 or 3 years, with additional schooling as a senior medic, he can be licensed to open his own clinic in the inner city. He's not an MD, but why don't we make it so the laws are where someone's a senior medic, they could actually have hospital beds. And limited, maybe they can't do surgery, but they could have an IV, they could do other things that are limited. You could maybe even do EKG. EKG is not so difficult anymore. I had one done recently, and I mean, they connected me. I think, was it a nurse who did it? I don't think it was a doctor. It wasn't a doctor who gave me the EKG. It had things on me, different places and stuff. And then they connected the machine for 5 minutes. Okay, here's your EKG. It's a lot easier than it used to be. Okay, now, let's see. So this young man, as this hypothetical example, he's a senior medic. He could open his own clinic in the inner city. Needed, so badly needed. No debt, no high level of debt from his medical schooling. Most white folks would be rejected, okay? I'm sorry to say it. If you talk about racial things, people say, oh, he's a racist. Well, I'm sorry, but it's just the way life can be anywhere in the world. I've lived in Europe, I've lived in Japan. I'll tell you what, there's racism everywhere. People think of racism as an American thing, white and black. No, when I was in Japan, I'll tell you what, Filipinos could be discriminated against, Chinese could be discriminated against, and the reverse is true. In China, I've been to Hong Kong 4 or 5 times, really liked Hong Kong. Anyway, excuse me, I'm getting off subject here. There's racism anywhere you go. Anyway, a black man or woman is going to be more accepted into a black neighborhood and helping people. Just as a woman doctor or a woman medic is going to be more accepted for helping women, right? Okay, call me whatever names you want to call me. Okay. Today, if a full doctor, under a current medical paradigm, a full doctor would have to add $87 per day to his daily bills. He's got to add this in his billing. He has to add it. So it's over $10 an hour, but that's after tax money. So it actually is like about $13 or $14 per hour he's got to add to every single bill. You can't do this for free. You can't do this where, okay, I've taped it up. I gave you 5 stitches. $50 should cover it. Can you pay me now, or you need to do it later or whatever? Okay, you can't do that. This is under the current system. The money is suffocating people. Okay, it's suffocating the patients. It's suffocating the young doctors. Okay, now let's go back to Helen. Let's go back to Helen in my example here. Okay, they get a phone call. Helen, we want to have you and your husband Jim come over for dinner soon, but we do have a problem. Yesterday, our daughter developed a bad cough, and she can't keep any food down. She's getting dizzy. Her temperature is 103. Is there any way you could swing by today to check on her. House calls. Let's put the patients first. Let's do house calls again. Why not? Why not? Why not have part-time doctors where someone is a doctor and something else? We do that with other professions. There's an old Western movie. I love old movies. I told you that last time. It's one of my vices. Old Western movie with John Wayne and Robert Mitchum called El Dorado. At one point in the movie, John Wayne gets shot. There's a bullet in his back. And he comes to after the operation. They've got him all taped up. The setting is the 1870s, 1880s in the Old West. Okay? So Robert Mitchum is the sheriff, and John Wayne is one of the a gunslinger kind of guy. Okay. Anyway, the town doctor, when John Wayne comes to, he wasn't able to do everything he wanted to do to get John Wayne fixed up. And the town doctor he says, some people call me a doctor, some call me a veterinarian, some people call me other things, but I'm the only one in town. And I really like that line because so many doctors in the past were self-trained, just like midwives, and veterinarians also, learning about animals. What's wrong with your horse? What's going on? It's limping. Let's check the hooves. Oh, let's check the hooves. Let's check the knee. Okay, just like midwives, many old-time doctors and veterinarians were taught through the experience of others. Older ones taught younger ones, okay? That system works. Okay, I want to jump. I'm almost done. I'm actually doing pretty good time-wise. I have a hard time staying on subject, as I told you. Eastern medicine. So Western medicine is what we've been talking about. Let's talk about Eastern medicine for just a minute here. Herbs and seeking balance. The yin and the yang. I can't put any Chinese music on this. Any music that you put into these videos online, they get all upset about. I don't know if I can do any sound effects of Chinese kind of music. Okay, never mind. People are going to say, that boy, has something wrong with him. I think he's racist. He's a bad person one way or the other. Okay, let's see. Yin and yang, Eastern medicine. It's opposites that need to stay in balance. It could be male, female, could be earth, sky, could be hot and cold, or light and dark, okay? Opposites that need to stay in balance. And this is true, this is believed and then practiced in Chinese or in Asian Eastern medicine. You have all kinds of herbs in India, in Thailand, in China and other countries, and they use these like ginseng, ginkgo biloba, licorice root, goji berries. I used to have a Chinese woman friend, and she loved her goji berries. Okay, it's a little red berry, probably about the size of a raisin. Little berry. You can get them in some health food stores. I have some. I got some in my kitchen now. Goji berries. I'll eat a few of them sometimes. How does it help me? I don't know. But it's a common Chinese herb. G-O-J-I, goji berries. Ginseng, I mentioned. G-I-N-S-I-N-G. There's 3 types. Chinese, Korean, and American ginseng. Ginkgo biloba, G-I-N-K-G-O space B-I-L-O-B-A. And then licorice root, you can spell that yourself. Okay, the body wants to heal itself. In Western medicine, what they often do is they bypass the body. They go around the body. They go around what the body's trying to do and say, bam, you're going to work again. Okay, it could be, in my opinion, it could be better. And the way we make doctors could be better. And the way we serve the public so that people are getting what they need at an affordable price without a horrible level of bureaucracy, without going the liberal route of let's make this so that everyone suffers. Let's not do that. The liberals think we need more wasted money and bureaucracy. No, instead, let's change how we make doctors. Why not have part-time doctors or someone who could change their career in their 30s or 40s to being a doctor? Why not? You can learn CPR in a day, right? CPR, cardiopulmonary respiration. You can learn how to take x-rays in a half hour, right? You know that, don't you, right? I met a young woman a few years ago, and she was taking a class in how to give shots, okay? And how to give shots, and so it was several young men and young women, they're taking this class, and they're giving shots to each other. Ow, ow, ow. Find the vein. I know it's in there somewhere. Ow. Okay, I'm sorry. But they could do that in a few weeks. Then she could learn how to give shots. I give blood at the Red. Oh, actually, let me hit this real quick. It's not in my notes. The Red Cross giving blood. I gave blood actually less than a week ago. Which one is this arm? Wasn't it? It's completely healed. It might be that dot there. Okay. I gave blood less than a week ago. The woman told me, the nurse told me, only 3% of the people who are eligible to give blood give blood. 3%? Is that true? That can't be true. Now, I give blood a few times a year. Okay, I just do. I don't like it, excuse me, but it's important. The only part about giving blood that I don't like, the only part of the process is giving blood. That's the only part I don't like. Other than that, it's fine. Bada boom. Okay. Anyway, but consider giving blood. Make an appointment. You have to make an appointment. They don't do walk-ins. Anyway, it's kind of a bureaucratic thing. They used to do walk-ins. They don't anymore, at least where I live in Indiana. You make an appointment, you go in, you got to read literature. Are you taking these drugs? Have you done this? Have you been outside the United States or Canada? A whole bunch of questions and stuff like that. Sex, lots of stuff about sex and things they ask questions about. And then they ask you anything you're not sure about, they ask you about. And then they're going to take your blood, and they have samples. Every single unit of blood, like I guess is it a pint? It must be a pint. Is double checked. They'll do several vials. They check for AIDS. They check for all kinds of things, of course, to make sure it's safe. Long ago in France, I'm almost done. Long ago in France, they weren't checking for AIDS. This is 1990s, late 1980s. It was after AIDS was discovered and is out there, and they weren't checking their blood supply. Well, inadvertently, France is a modern country. Inadvertently, they spread AIDS to all these people through blood transfusions. Horrible thing. Anyway, okay, so medical things, we can do better. The French can do better. The Japanese with dentistry can do better. What we need is not more bureaucracy. What we need is we need to change how we do this so that caring people can get into the profession and maybe even be part-time, or it's part of what they do, or they're on a ship. What if you're on a ship sometimes, some kind of a transport vessel, and you're a staff medic, so you have licensed to be able to help people while you're out there. Okay, why not? For electricians, we have apprentice, journeyman, and master electricians, right? HVAC is similar. You start out as an apprentice, you work your way up. Plumbing and other things. And also, that's the way it is with midwives also, isn't it? Right? I mean, they learn over time. They learn, here's what happens. Oh, the baby's in the wrong position. We've got to adjust. After the water breaks, that we can adjust the baby a little bit. We can adjust things and move it. Did you know that in some hospitals today, in some medical hospitals, they have tongs to pull the baby out? Oh, why would you want to do neck injury to a defenseless baby right as it's being born? Let's go back to midwives, please. Okay. And then a hospital, of course, has all kinds of germs in it. You've got people in there who are sick. A woman who's about to deliver a baby is not necessarily sick. She may be sick of being pregnant, but she's not sick, okay? But all these other diseases are out in the air and stuff, and now you got this vulnerable mother and child. Okay, now, last time I gave you 2 books. I want to mention 2 this time. Dr. Andrew Weil. He's written several books. This may not be his best one, but I've got a few of his books. This one was handy. Weil. Dr. Weil went to Harvard Medical School, and then he started learning things about healthcare. Oh, oops. Was something negative implied in what I just said there? Oops. Okay, so Dr. Weil has become an advocate in American society and the Western world for, let's consider other things, other treatments that work. If something works, maybe that's what we want. Anyway, Weil, you can look him up, Dr. Weil, and he recommends this book, which my son sent me a few years ago, Integrative Nutrition. This is a really good book. On the top of the book, okay, so this book is Dr. Weil, Weil, Healthy Aging. He's written several good books, okay? Integrative Nutrition is by Rosenthal, Joshua Rosenthal, and on the top is a quote from Dr. Weil. I recommend Integrative Nutrition as a must-read for everyone interested in this most basic component of good health. Okay? The title of one of his other books, which I have. Dr. Wild's book, best-selling author of this is the title of a book, 8 Weeks to Optimum Health and Healthy Aging. 8 Weeks to Optimum Health Optimum Health and Healthy Aging. This is a really good book, Integrated Nutrition. I'm smiling because I'm going to tell you something that happened in this. So he's got all kinds of stuff, dietary things, different kinds of stories of people and stuff. Okay, early in the book, I'm about to finish. Early in the book, he mentions he was on a certain diet, and I think the diet excluded meat. It was a few years ago when I read this, but it excluded meat, and he just started craving meat. His body's just craving, and he didn't understand it. So finally, he goes to either Burger King or McDonald's or Wendy's or something, and he the way he describes it is this is my recollection. The way I remember it is almost as an out-of-body experience, like he's watching what he is doing as he goes through the drive-thru. So he orders a double burger or something like that. Nobody can see me, right? And he orders this thing with extra vegetables. Could you put extra lettuce and tomatoes on it, please? And whatever. And then he eats it and stuff. Okay, vegans, you are dying. You're dying. Okay, I'll talk about more nutrition stuff later, but some people who think they're doing what's right for them, they're not getting the nutrients they need. I talked about that a little bit in the last episode. We're in a culture now where we have so many deceptions in our modern world. Okay, I need to finish. I hope this is interesting. I hope I stayed on topic enough that maybe the gist of what I wanted to communicate gets through. I realize cave people will be against these ideas at every step of the way, but why don't we have this discussion? Why don't we talk about this? Why don't we do this? Just change how we make doctors. Nurses. See, the nursing paradigm is a different paradigm. Candy stripers. I didn't plan to talk about this. Well, you have candy stripers, which is usually, it used to be like a pink and white dress. That's why they were called candy stripers. They could deliver medicine to a patient or change a bandage or something like that. Yet LPN, licensed practicing nurse, but that's not really what it stands for. LPN actually stands for low paid nurse, okay? Or it stands for let's pretend nurse, okay? Okay, then you got the RN, and then you have above RN, you have people with different specialties, women and men who are in the nursing field who have different specialties. Okay, folks, thank you for watching. God bless you. Have a good day.